Today on AI DocuFeed.
Studies have shown a significant reduction in the number of surprise medical bills since the act went into effect. Patients are reporting fewer instances of receiving unexpected bills for out-of-network care, which suggests that providers and insurers are adapting to the new rules and that the act's protections are taking hold.
Welcome to the podcast that simplifies dense handbooks, insurance plans, and complex documents so you can focus on what matters. This is for informational purposes only and doesn't provide legal, financial, tax, or medical advice. Always consult a professional for your specific needs.
Okay, so imagine this. You're rushed to the ER after a really bad accident. You're just so relieved to be getting the care you need. But weeks later, a bill arrives for thousands of dollars from a doctor you never even saw.
Ugh, the worst.
Yeah. That's a surprise medical bill, and it used to be a total nightmare for so many people.
Yeah, until recently, those surprise bills were a huge problem in the U.S. healthcare system, The lack of transparency meant patients often had no idea they were receiving care from out-of-network providers until they got the bill.
So enter the No Surprises Act. It's been a couple of years since it went into effect, so we're taking a deep dive on how it's reshaping the healthcare landscape.
Yeah, so in this deep dive, we'll focus on the Act's protections against surprise medical bills, especially in emergency situations. We'll also look at the limits it places on balance billing and the dispute resolution process for those, tricky out-of-network charges. And of course, we'll explore the transparency rules that are supposed to help patients verify costs up front.
Awesome. Okay, so let's start with the basics. What exactly does the No Surprises Act cover?
Well, the Act has a strong focus on emergency services. It ensures that, if you need emergency care, you're only responsible for your in-network cost-sharing amounts, regardless of where you receive that care.
Okay, so even if I'm taken to an out-of-network hospital during an emergency, I won't be hit with a massive bill from, out-of-network providers.
Exactly. That's the idea. The Act protects you from balance billing in emergencies, which means the provider can't bill you for the difference between their charges and what your insurance pays.
Oh, that's such a huge relief. Okay, so what about those situations where you're at an in-network facility, for a planned procedure, but an out-of-network specialist, like an anesthesiologist, gets involved?
The Act addresses those situations, too. It extends protections to certain non-emergency services you receive at an in-network facility. This means if you have, say, a scheduled surgery at an in-network hospital, you shouldn't get a surprise bill from an out-of-network anesthesiologist or, radiologist who assists in your care.
So I'm protected, even if I don't choose the out-of-network provider.
Exactly. The Act recognizes that you may not always have control over which specific providers are involved in your care, especially in, complex medical situations.
That makes a lot of sense. Okay, so besides these protections, are there any measures in place to kind of prevent these surprise bills from happening in the first place?
Yes, the Act tackles the issue of transparency head-on. One of its key provisions requires providers and insurers to keep their provider directories accurate and up to date. This means you should be able to check if a provider is in your network before receiving non-emergency care.
That seems like a really simple but crucial change.
Totally.
Inaccurate provider directories were a huge source of surprise bills in the past.
Patients often had no way of knowing a provider was out of network until they received the bill. By, mandating accurate directories, the Act aims to give patients the information they need to make informed decisions.
So essentially it shifts the burden of verification from the patient to the providers and insurers who have access to that information.
It empowers patients by giving them the tools to verify costs and avoid surprises.
Wow. This focus on transparency is a big win for consumers. It seems like the Act is really trying to level the playing field.
It is. It recognizes that patients shouldn't be penalized for a lack of transparency in the healthcare system.
For sure. Okay, so let's say I specifically choose to see an out-of-network provider, for whatever reason. Does the Act offer any protection in those cases?
In those situations, the Act focuses on informed consent. It requires out-of-network providers to obtain your consent before providing care, and this consent needs to be more than just signing a form at the last minute.
Oh, okay. So what else is involved in this informed consent process?
The provider must give you a detailed estimate of the costs at least 72 hours in advance. They also need to clearly explain that you may be responsible for higher out-of-pocket costs compared to an in-network provider.
That makes sense. It ensures that patients who choose to go out of network are doing so with a full understanding of the, potential financial implications.
Exactly. It's about making informed decisions, not about limiting patient choice.
This all sounds like a pretty major shift in how healthcare billing works. It's exciting to see these patient protections being put in place.
It's definitely a step in the right direction. The No Surprises Act represents a significant effort to address a problem that has plagued the U.S. healthcare system for far too long.
Okay, so we've talked about protections for emergency and non-emergency care and the importance of transparency and informed consent. But, what happens when a disagreement arises between a provider and an insurer over payment amounts for out-of-network care?
That's a great question because in the past, these disagreements often left patients caught in the middle, facing bills for the remaining balance.
It sounds incredibly stressful and confusing for patients.
It was. To prevent that, the No Surprises Act established a federal independent dispute resolution process, or IDR for short.
So this IDR process is designed to resolve payment disputes without involving the patient.
Exactly. When a provider and insurer can't agree on a payment amount for out-of-network care, they can initiate this IDR process instead of billing the patient for the difference.
That takes a huge burden off the patient's shoulders. So how does this IDR process actually work?
It involves a neutral third-party arbitrator who reviews the information submitted by both the provider and the insurer. The arbitrator then determines a final payment amount that both parties must adhere to.
This sounds much fairer than leaving patients to navigate complex billing disputes on their own.
It is. The IDR process is a key part of the No Surprises Act because it provides a structured mechanism for resolving disputes and ensures that patients are not caught in the crossfire. So this IDR process, it's a key element of the No Surprises Act, and it's designed to be fair and efficient. However, there are different perspectives on its effectiveness and potential impact.
Oh, that's interesting. You're saying there's more to the story than just having a neutral party settle disputes.
Right, yeah. Some argue that the current IDR process might inadvertently incentivize providers to inflate their initial charges.
Why would they do that if, a neutral arbitrator is going to determine the final price anyway?
Well, the thinking is that providers might submit higher charges, knowing they can go to arbitration if, the insurer pushes back. This could lead to a scenario where the arbitrator ends up setting a payment amount that's higher than what might have been, negotiated otherwise.
So it's a concern that the IDR process could actually drive up healthcare costs instead of keeping them in check.
Yeah, it's a valid concern. It's a complex issue, really, with potential for unintended consequences. And it's something that policymakers and stakeholders are, actively monitoring and evaluating.
It makes sense that ongoing analysis and adjustments are needed as we see how the act plays out, in real-world scenarios.
Absolutely. As with any major legislation, it's important to gather data, assess the impact, and make refinements as needed to ensure it's achieving its intended goals.
This highlights the dynamic nature of healthcare policy and the need for constant evaluation and adaptation.
Precisely. The No Surprises Act is a significant step forward, but it's not, a one-size-fits-all solution. Ongoing dialogue and collaboration among policymakers, providers, insurers, and patients are crucial to shaping a healthcare system that works for everyone.
Speaking of ongoing dialogue, are there any other areas where the act might be expanded or refined in the future?
One area that's receiving attention is the scope of the Act's protections. As it stands, the Act primarily focuses on surprise bills from emergency services and certain non-emergency services at, in-network facilities.
So there are still situations where patients could potentially receive surprise medical bills, even with the act in place.
Yeah. For example, the Act doesn't currently cover ground ambulance transportation, certain types of behavioral health services, or services provided by out-of-network providers at freestanding clinics or facilities that aren't part of a hospital system.
Those sound like pretty significant gaps in coverage.
They are. And, it's why advocates are pushing for the Act's protections to be broadened to cover a wider range of healthcare services.
Expanding the scope of the act seems like a logical next step in strengthening consumer protection in healthcare.
It's a complex issue, though. Expanding coverage would need, careful consideration of its impact on healthcare costs and access to care. It's a balancing act between protecting patients and ensuring a sustainable healthcare system.
It sounds like there are many factors to weigh when considering potential changes to the act.
Absolutely. Policymakers need to strike a balance between addressing consumer concerns and avoiding unintended consequences that could negatively impact the healthcare system as a whole.
It's fascinating to see how the No Surprises Act is like prompting these important conversations and driving positive change in healthcare.
Yeah, it's a dynamic process, and it's encouraging to see policymakers, stakeholders, and patients engaging in these discussions to shape a more transparent and patient-centered healthcare system.
Now let's shift gears a bit and talk about what the Act means for patients on a practical level. What can listeners do to make sure they're protected and avoid surprise bills?
The more you understand about the No Surprises Act, the better equipped you'll be to advocate for yourself and avoid unexpected costs.
Okay, so what's the first step?
Start by familiarizing yourself with the key provisions. We've covered many of them in this deep dive, but there are also excellent resources available online through, the Centers for Medicare and Medicaid Services or CMS and other organizations. Once you understand the Act's provisions, share that knowledge with your friends and family, spread the word about these protections, and help others navigate the healthcare system with confidence. Another crucial step is to be proactive when it comes to your healthcare. Before receiving non-emergency care, take a few minutes to check your insurance company's provider directory to confirm, whether a provider or facility is in your network.
That seems like a simple but potentially money-saving step.
It is. Taking a few minutes to verify network status up front can save you from a lot of headaches and potential financial stress down the road.
And what if, despite all your best efforts, you still receive a surprise medical bill?
Don't panic and don't ignore it. You got to take action. Remember, the Act provides avenues for recourse.
So what should listeners do in that situation?
The first step is to contact your insurance company and the provider who sent the bill. Explain that you believe you've received a surprise bill and outline the reasons why you think it's, incorrect.
So it's about initiating a dialogue and trying to resolve the issue directly with the parties involved.
Yes, open communication is key. If you're unable to reach a resolution through those initial conversations, the Act outlines a process for, filing a formal complaint.
So there are escalation paths for situations where a simple phone call doesn't solve the problem.
Exactly. You can file a complaint with your state's insurance regulator or with the federal government, through CMS. When filing a complaint, be sure to provide all relevant documentation, including the bill, your insurance policy information, and any correspondence you've had with the provider and insurer.
Being organized and having all your ducks in a row is crucial when navigating these situations.
Absolutely. The more thorough you are in documenting your case, the better equipped the reviewing agency will be to assess the situation and help you reach a fair resolution.
Now, I'm curious about the bigger picture. What kind of impact is the No Surprises Act having on the healthcare industry as a whole?
It's still relatively early days, but we're already seeing some positive results. Studies have shown a significant reduction in the number of surprise medical bills since the Act went into effect.
That's fantastic news.
It is. Patients are reporting fewer instances of receiving unexpected bills for out-of-network care, which suggests that providers and insurers are adapting to the new rules and that the Act's protections are taking hold.
It's encouraging to see these tangible results. It seems like the Act is having a real impact on the ground.
The Act's provisions are changing the landscape of healthcare billing and prompting important conversations about transparency, accountability, and patient empowerment.
Besides the reduction in surprise bills, are there any other notable effects of the Act?
Well, the Act is also fostering greater transparency in healthcare pricing. With the requirement for accurate and up-to-date provider directories, patients now have more tools to, compare costs and make informed choices about their care.
This increased transparency is likely to have ripple effects throughout the healthcare system, potentially leading to more competitive pricing and better value for consumers.
That's a possibility. As consumers become more aware of costs and have more options to choose from, providers and insurers may face pressure to offer, more competitive rates and services.
It's exciting to consider the long-term implications of the Act and how it might reshape the healthcare market.
It's a dynamic situation that will continue to evolve, but the early indications are positive, suggesting that the Act is moving the U.S. healthcare system in a, more consumer-friendly direction.
It's been so fascinating, exploring all these nuances of the No Surprises Act and its impact, on the healthcare landscape. It's clear this legislation is a game changer, but also kind of highlights how important it is to stay informed,
Absolutely.
Advocate for our rights as patients.
Absolutely. The No Surprises Act is a powerful tool, but its effectiveness really depends on people knowing their rights and, taking action when they need to.
So it's not just a passive protection. We need to be proactive about understanding and, utilizing the Act's provisions.
The more we know about the Act, the better equipped we'll be to, navigate the healthcare system confidently.
Right.
And avoid those unexpected costs,
Okay, so let's recap some, key takeaways for our listeners. What are the most important things people should do to ensure they're protected?
Okay, so first, stay informed. Keep learning about the Act's provisions through, reliable sources like CMS and reputable healthcare organizations. Second, spread the word. Share what you've learned with your friends, family, and community.
Yeah.
The more people who understand their rights, the stronger our collective voice becomes.
Totally. It's about empowering each other to navigate healthcare effectively.
Precisely. Third, be proactive when seeking care. Before scheduling non-emergency procedures, take a few minutes to, check your insurance company's provider directory just to confirm whether the provider or facility is in your network.
That simple step can save you so much trouble.
Oh, yeah.
And potential expenses down the line.
And finally, if you do receive a surprise medical bill, don't ignore it. Take action.
Right.
Contact your insurance company and the provider. Explain why you believe the bill is in error. And, follow the steps we discussed earlier for disputing the charges.
This has been incredibly empowering. It's given me a much deeper understanding of how to navigate healthcare billing and advocate for myself and, my loved ones. Well, thank you so much for, sharing your expertise and insights today. It's been a truly enlightening conversation.
It's been my pleasure.
To our listeners out there, stay curious, keep learning, and, take charge of your health and your finances. Until next time, stay well.
Thanks for listening to AI DocuFeed. Please subscribe, review, and share. Until next time, stay well and stay informed.